Welcome to Marine Hills Animal Hospital. It's our staff meeting, and for a medical moment today, we're going to talk about anaphylaxis. Everyone has an immune system, and your immune system generally does a great job of protecting you against bad things. But every once in a while, the immune system hits a panic button and overdoes it. And when that occurs, we call that anaphylaxis. The trigger for anaphylaxis is often a biotoxin of some sort. Often a bee sting is the most common one that we see, a spider bite. It on rare occasion is a response to a vaccination, which we do here at the hospital. But biological things are often the trigger for this overreaction of the immune system called anaphylaxis. There's several features of anaphylaxis that you can recognize it. There could be a low-level reaction to biological agents where you have puffiness and swelling. You know, the bee stung you on your foot and your foot swells up. You could have signs of an overreaction elsewhere with hives, sometimes itchiness. Those things usually occur a good time after the event. So a half hour to an hour is when the swelling would start to show up, maybe 2 hours later, that sort of thing. Anaphylaxis is different because it's right now. And the quicker it happens, the more serious it is. Dogs and cats that experience anaphylaxis will suddenly be weak or pale. They may vomit or have diarrhea. They may collapse. If that happens very quickly after the event, a bee sting, etc., it's really serious, and you need to be at or on your way to an animal hospital where your pet can get assistance. And so it's really important to recognize when it's happening and to seek help quickly, okay? The first thing that we do at the hospital when we see a case of anaphylaxis is we start supportive care. While we simultaneously try to figure out the why, because in the event that the why is a bee stinger, it would be lovely to remove the bee stinger so there isn't more venom from the venom sac being pumped into our patient. But at the same time, we are treating their symptoms. And the major way that we treat them is to support them in their shock experience. Shock means when there is suddenly not enough blood volume to circulate throughout the body. And dogs and cats are not the same. They're different in the way they respond to shock. The shock organ in the dog is the liver. The shock organ in cats is their lungs. Do I see nods of approval? Have I got that right? And their gut. Sometimes it's not clear, a pet who comes in collapsed, that it is actually anaphylaxis. Of course, there's other reasons why pets collapse. That is not an overactive immune response. And sometimes the challenge is to figure out, is this particular collapsed pet having a problem with an overactive immune response? Many of the things we do to treat them are similar, but there are some things that might differ, and so it's nice to know for sure. One of the ways that we can determine if a dog is having an anaphylactic event is we can take a blood sample, because since their liver is the shock organ, they often will have a sudden spike in their ALT, one of the liver enzymes. Also, we can use our ultrasound and look at the gallbladder. It turns out that dogs who are having an anaphylactic response often will have edema in the wall of the gallbladder, and that's a quick, easily found, and a quick tool we can use for diagnosis. The fundamental treatment for anaphylaxis is to support the shock and to stop further reaction. We had a case yesterday of a little dog that was stung by a bee. The same dog was stung by a bee 10 years ago, and her face swelled up. Well, now, this time, she collapsed. And we found the stinger in the pad of her paw. Now, she happened to be a diabetic as well, so there's other reasons why a diabetic might collapse, right? So we checked her blood sugar. It was not low. That was not the reason for her collapse. And we did find a bee stinger, so that's a likely explanation. We did confirm that it was anaphylaxis by looking at her liver, both with blood work, and her ALT did spike. And we also looked at her liver with the ultrasound. Interestingly, when she first walked through the door, her gallbladder did not have edema in the wall, but within 15-20 minutes it did, the second time we looked. Of course, we weren't just diagnosing her, we were treating her simultaneously, and you guys did a great job, by the way, thank you. We gave her oxygen for support. We placed an IV catheter, yay. which is not easy on the collapsing dog. We gave her an injection, well, first some IV fluids, and her blood pressure unfortunately continued to drop even though she got IV fluids. And her EKG was poor. She was having no atrial contractions that we could see on our EKG. She was having escape beats from her ventricle at a very low rate, about 50 beats a minute. So we gave her IV epinephrine, which did a nice job of bringing her heart rate back into the normal spot. Her blood pressure did not improve initially after the crystalloid fluid, so we gave her a volume expander called Hedistarch, and that did a really good job of helping bring her blood pressure up. And she just continued to look good as the day went on. We did also give her an injection of diphenhydramine, Benadryl, which blocks further allergic reaction. We might have given her an injection of steroids, except she's a diabetic, and so we were trying to not give her a big jolt of steroids. Had she not been improving with our therapy, that was next. We were going to do it. It would have consequences on her diabetes management, but we have to get past the "you're going to die right now," clearly, and we did that very successfully without having to give her steroids, though we might have had to. So that's what anaphylaxis looks like, and you all did a very good job of responding. And Abby's doing fine today.
Yeah, she
Yes.
came in, had a catheter out and
Good.
great.
Questions? Yes.
Was she still able to get her insulin and go back to her normal routine?
Yeah, so this particular patient was a diabetic, and her blood sugar was high in the evening, and so she did get her insulin. And then the plan was if she ate breakfast this morning, she would just have her insulin as normal, which she did, right? She was back to feeling well.
Yeah, she was
Yeah.
great.
Any other questions? No, good. All right, thank you.